virtual open evening for our MSc in Surgical Innovation that is running at Imperial College London. As I mentioned before, we are recording this session and we will make it available on probably our Twitter stream and also on the website. So if your internet connection proves not to be reliable enough, then you can always look it back later. And I also include my information on the last slide, which includes my phone number and my email address. And I'm always very delighted if you want to reach out and discuss anything we talk about more. As I said, my name's Christopher Peters. I am the one of the course directors of the MSc in Surgical Innovation, and my background is I'm a clinician. I'm a consultant upper GI cancer surgeon based at Imperial, and I run this course in combination with Fernando Bello, who is a scientist and also working at Imperial. So all of you have registered today because you are interested in this master's program. And what I aim to do today is cover a little bit about what the course involves, what you might learn on it, and how it might help you advance your career, and in particular advance an academic career. So starting off, who is the course for? The majority of people on our course are surgical trainees of various levels. If it's a UK system, they tend to be FY2 level up to middle of ST grades. But we do also have a number of people who are other members of the MDT teams, including specialist nurses, theatre nurses, cancer coordinators, and also research coordinators. And fundamentally, the course is designed for anyone who wants to develop a solid academic foundation on which to build their career. And for that reason, it's designed to be studied part-time over 2 years, because it's designed to fit around people who are working clinically, in particular junior doctors, designed to fit around their clinical training. And for that reason, it's 7 taught weeks, which are largely face-to-face, though obviously in the last 2 years that's been disrupted by the pandemic. And then there is a library dissertation, which we're now taking the format of a mock grant application and a research project. So the first question we often get asked is, can you do it whilst working as a CT trainee or an ST trainee or whatever? And the answer is not only yes, but that is the majority of the ways people do the course. Most of our students are surgical trainees who are currently working in one way, shape or form. What does the course look like? Well, it's broadly speaking divided into 3 components, but the master's course is a combination of all 3. It starts out with 4 core modules, which are taught, which I'll come into in more details, and then builds on that with what we're calling the mock grant application and the specialty modules. And again, I shall talk about that in more details. And then the full master's is made up by all of that in combination with a research methods module and a research project, which can be either something very face-to-face or something more in silico. So, roughly speaking, the PG Cert is about 8 months part-time learning with the 4 blocks of teaching. The PG Cert and the PG Dip combined are 16 months with 2 additional weeks of teaching, plus the library module, which now takes the form of a mock grant application. And then the PG Cert, PG Dip, and the Masters, which is what the vast majority of our students do, includes an additional taught module and then the research project. We will be moving in September to only accepting people registering for the full Masters, but every year we have people whose circumstances change and who find they can't carry on the course for various reasons. And we're retaining the PG certificate and the PG diploma as exit degrees. So if you have achieved your 4 core modules, but then for whatever reason need to take a break from the course, then you can still exit with a full qualification, and then you can always return later. So the postgraduate certificate components of it includes 4 core modules, which are principles of surgery, surgical education, leadership, safety and quality, and technological innovation. And the principles of surgery is one of our first modules. And the idea of this is to give you a good foundation and get everyone up to speed in advances in the field of surgery, physiological mechanisms of surgery, such as a response to stress, shock and healing, and introduction to minimally invasive approaches and the development of new technologies, but also including perioperative care, because this is a holistic module that covers more than just what happens in the operating theatre, but covers what happens to the patients before and afterwards. After this, we have a surgical education module. One of the most important things to say about this is that it fulfills the criteria for a week of formal educational teaching for CT and ST applications. And it's designed around the idea of understanding the principle and theories of education, assessment, appraisal, how to incorporate training into everyday work, the policy and context of surgical education, simulation educational technologies, and it helps you develop your teaching skills. We're very fortunate that this module is led by the same team who deliver the Masters in Surgical Education, which is a 2-year part-time course. Therefore, you get a great deal of experience and understanding of this topic in this very intensive module, which is now currently run over a period of a month in a virtual format. Improving safety and implementing change is one of our most important modules, and partly that's because I think it exceeds people's expectations. Because what this does is it teaches the actual science and practice of quality and outcomes research and the tools and mechanisms designed to assess quality. Any of you working anywhere in the world will constantly be encouraged to do audits, but what this does is actually teach you how to properly do quality and safety projects. Designing them, implementing them, and evaluating them with a very highly practical focus with multiple toolkits presented. And of all the modules, this is the one that people find can most immediately be implemented in their day-to-day clinical practice. Interventional technology and imaging is one of the more cutting-edge modules, and it explores how the boundaries between surgery, endoscopy, and radiology are completely disappearing, using exemplars from the most cutting-edge stuff that Imperial is doing in these topics. And it learns about the technological developments and innovation that have been the major turning points in the past, but then more excitingly talks about those that are going to be in the future. And if you consider and appreciate the technologies currently in use, then you can consider how you can work with other disciplines to develop new technologies yourself. And Imperial, for those of you who don't know, is a university that doesn't do humanities, it does medicine, it does technology, it does engineering, it does computing, and therefore this module very much builds on that interplay between those different specialities. And then lastly, then you move on to the PG diploma, and this is where we end up giving you some choice. The whole point is that we want this Masters in Surgical Innovation to match you in your career paths. Therefore, currently we offer the 7 optional modules, and you pick the ones that most match your career aspirations. The trauma module includes a day on casualty assessment and including mock trauma calls, and then the second week includes dealing with damage control laparotomies and even doing cadaveric dissection. The orthopedic module is, broadly speaking, divided into elective and emergency. The upper GI module is divided into esophagogastric cancer and benign, and then a week of bariatrics. Colorectal, likewise, is divided into benign and cancerous. And then we also have the ENT, transplant, and vascular modules as well. Vascular is divided into sort of venous and small vessel versus large vessel. And these modules are led by clinical academics at Imperial who are leaders in their field. And again, they are built around the idea of understanding how innovation is occurring in these fields and understanding where these fields are moving over the coming decades. As part of this as well, we've started, this year will be the first year we do this. Previously, we've done a library dissertation, which is effectively a systematic review. But the cohort that will be starting in September will be doing a mock grant application instead. This is based on feedback from our students, and we know that actually one of the things that is most tricky in academia is writing grant applications. Therefore, the idea is that you'll come up with a research idea of your own, or we'll give you ideas and ones that you can pick from, and you'll build this into a mock grant application that will include a literature review of the field, but then begin to think about the methodology you might use to answer your research question, building on all of the different modules that you've done up until this point. Subsequent to this, and actually in parallel, and in fact you do this research methods module much earlier than this suggests, you'll do a module that covers the different research modules that the research methods that you can use, and then you'll develop your own research project. Now, the really interesting thing here is we will offer you a wide variety of research projects that you can pick from, but in addition, you can develop one of your own. And for many of our students who do the master's program from outside of London, that means that they can develop a research project that works in their own hospital with their own local supervisor, implementing something which is going to be direct benefit to their trust. And then we will offer you an Imperial co-supervisor just to make sure everything remains on track. We have a very wide variety of projects, ranging from augmented reality projects in surgery and multiplayer platforms for learning, through to more systematic reviews of how to manage reflux in morbid obese patients. We have projects built around wearable technologies, and then we have in silico projects around calculating the success rate of cancer biomarkers. So we have an incredibly broad range of topics. And the other thing we always point out is that you may be interested in the specialty that we don't represent in our core modules. So for example, urology at the moment we don't offer as one of our optional modules, sorry. Therefore, what we normally suggest is you pick the module that is of most interest to you, but then you can pick a research project that fits with your eventual career aspirations. The entry requirements is a medical degree or a 2-1 degree in a health-related science. And we normally request at least 1 year of clinical experience if you are a UK trainee, because we think that FY1 year is very important for you to get a feeling of how the NHS works as a doctor as opposed to a medical student. And we also think that it's important for you to settle into your FY1 year without being distracted by a master's programme. We are, however, we're very fortunate. We have a large number of international graduates doing our master's program, and they add a great deal of richness to the experience that the students can offer to each other. And we are aware that in some of those international medical schools, the setup of things is different, and therefore it may be appropriate that you can go straight into the master's program from graduation. And that's something that we're very happy to discuss with you on a one-by-one basis. What I am really interested in as the director of this course is that this course improves your academic opportunities. And that is why I do this. That is why I put effort into this, because what we want to do is to finish the course with more skills, more experience, and therefore more opportunities. And that can mean many things to many people. You know, we are very aware that many people will use this master's program to improve their employability, be that employability in the UK for the first time. And we have lots of students who come to us from overseas and in parallel get their GMC registration and then use the master's and their GMC registration to obtain their first jobs in the UK. We have lots of students who are doing it because they're applying for either core training in surgery or higher surgical training, and they're using it to improve the quality of their CV and improve the quality of what they can offer. But what we're most wanting to do is give you a holistic basis of understanding academic surgery. And I think these quotes here on this screen just give us some examples of what people have got out of this. And what we offer is a very diverse range of lecturers with massive experience in innovation who can offer their kind of real world experience and that ability to network with them and the other students on the course. So this is my last slide. This is my email address, christopher.peters@imperial.ac.uk. This is also available on the Surgical Innovation website on Imperial. This is also my mobile number. I am very happy to talk to anyone who's interested in the course. And in particular, I think pretty much everyone on the course has spoken to me before they enrolled to get some personalized advice for them. And I will always be honest with you about when the course is right for you and whether the course is right for you. And I'd be absolutely delighted if anyone wanted to reach out.